Stop right where you are. Give us 30 minutes and we'll give you the best way to a healthier and better life. This is groundbreaking and exciting. That's worth just half an hour of your time, isn't it? Look, we care about you, and today we are focusing on your health. My guest is someone who is responsible for the care of 5 million patients in 13 states and who is right here in Palm Beach County, Dr. Stephen Charlap, educated at New York University and Harvard, can not only help to improve your health, but can give you the type of service that would cost you thousands of dollars at Pritikin, Canyon Ranch, or the Cleveland Clinic. And for many of you with Medicare, you can get this kind of high-level service and care at no cost, no copays, no deductible, nothing. There is no greater return on investment than an investment in your health. So come along with us to find out how to live a healthy, vibrant, and long life so you can live rich and die rich. Let's go. Hello, I'm Howard Kaye. Our guest today is Dr. Stephen Charlap. He heads MDPrevent, South Florida's foremost preventative medicine and learning center. If you have diabetes, if you're overweight, if you want to prevent illness, instead of first suffering and then treating it with costly and invasive medical treatments after you're sick, this is the person that you need to listen to closely and then come and see. It will change your life. The previous organization he founded and led for 20 years is the largest U.S. provider of medical and dental services to the extended care industry. He is nationally recognized for changing medical and dental services to the extended care industry. Today, learn what Dr. Charlap is doing to change healthcare again by his focus on primary disease prevention and wellness. Welcome, Dr. Charlap. It's great to have you here today.
Thank you, Howard.
Now we're going to get into some of your remarkable work, but before we do, I just want to say that for years now, we have always, at our company, Howard Kaye Insurance, have shown people how to utilize the concepts that we have created for our own family. So everything that we educate people on are things that we have done. Well, once again, you and I met, and within a matter of moments, maybe seconds even, I said, you have the answer to really changing my life. And once I realized how you can help me, it's no different than in my world of business. How can I get that message out to others? Because while insurance may be my primary focus, what's really everyone's focus? It's their health and living a long, healthy life and enjoying and having a quality of life. So with that, I thank you for introducing yourself to me and sharing with me. Let's get this message out to everybody else. So right off the bat, let's just start with MDPrevent. The mission, you had said earlier to me, it's not what we can do for people. What is the mission behind MDPrevent?
The mission is to help people change their lives. As you said earlier in the promo, I spent 20 years taking care of 5 million patients. I saw firsthand what happens to Americans who live their lives a certain way, develop chronic disease, end up being institutionalized and becoming dependent on the kindness of strangers. And I said there had to be a better way. And when I discovered that Medicare, for the first time in its history, was going to pay doctors to spend time on identifying risk factors and figuring out ways to prevent disease as opposed to simply treating it, I became euphoric. And as you know, I came out of retirement because in retirement I realized that I still had a lot of great things left in me to do. And I don't think I could do anything greater than helping people change the course of their lives and live better quality of lives today.
But it's interesting when you talk about this whole idea of prevention. going through medical school, going just through our society and knowing what we are taught as a society, it seems that you get the disease, like you said, or an illness, and then you get treated for it. But you're trying to reverse that whole thing by saying there's no reason that you should get the illness or disease if you do everything you can from a preventative measure, which goes along with a complete change of lifestyle that we were not taught as a child growing up into adulthood.
Right. 2,500 years ago, Hippocrates said, prevention is preferable to cure. And over 200 years ago, the great American statesman Benjamin Franklin nailed it when he said an ounce of prevention is worth a pound of cure. And yet our healthcare system today is predicated on treating problems once they develop and doing virtually nothing to stop the problems in the first place.
You know, it's interesting because it's such an old cliche that an ounce of prevention is worth a pound of cure, but it is so true. When we talk about MDPrevent, we've discussed what the mission is behind it, but let's get into really discussing what MDPrevent is, because there are some very important aspects of this. I don't know, do you call it a company, a business, or just a way of life for people?
Right.
How do you define it?
Well, first and foremost, Howard, for me, this is a calling. Since I can remember, I have been trying to help people. From my early school days, I was always involved in activities that impacted the most possible people. And I don't think anything I've ever done until this point in my life can have a greater impact than helping change the course of people's lives. By MDPrevent, I mean there are 4 major factors that affect the quality of our life on a daily basis: our nutritional status, our physical fitness, the way we deal with stress and anxiety, and how much sleep we get. And so I put together an organization that on day one put together all those degrees of intervention in one place: a health psychologist, a registered dietitian nutritionist, a fitness instructor, a health educator, a primary care nurse practitioner, and a physician. And we call ourselves aptly preventioneers because we are prevention pioneers.
But MDPrevent, and I want to bring this slide up for people, talks about 5 major things. You have primary care, wellness and prevention, emotional and psychological health, as you've just said, nutrition and fitness, and the screening and diagnostics. Can you just go through each of those steps to share with everybody what that all means and what they will be seeing at MDPrevent?
Right. So we take a holistic approach. We believe that we need to understand fully what is going on in that person's life. One person may be overweight because of emotional eating or binge eating. Another person may be overweight because they really enjoy food. A person may be diabetic because they've been eating poorly their whole life or because they've been under undue stress. We try to look at all aspects, making sure that there's no underlying medical condition that may be contributing to being overweight. For example, thyroid disease. A lot of doctors underdiagnose thyroid disease. We look at it very carefully. We do a series of tests to make sure that we don't miss anything. And once we rule out that there's an underlying medical condition, we get into aspects of their daily living. What do they eat for breakfast, lunch, and dinner? How much exercise do they really do? And do they simply go to the gym once a day or 3 times a week, and the rest of the time they're watching TV or sitting around at a desk? Do they sleep enough, or are they getting up multiple times over the night? How are they dealing with stress? You know, we all have stress. We can't necessarily change the input of that stress, but we can change the way that we deal with it.
So really what you're doing is you want to look at all aspects of somebody's lifestyle and show them how to change all of these different things for a better, healthier life. Now, you mentioned earlier preventioneers. Is that the correct word?
Correct.
Okay. Talk about the preventioneers. I know you've got doctors, nurse practitioners, psychologists, as you said, wellness coaches. How does this all fit into MDPrevent?
So, you remember the old Olympic team, the dream team of the best basketball players on the world.
Right.
And I brought together the top professionals that I could find. A health psychologist trained at Emory, a registered dietitian trained at New York University, a yoga instructor who is master level trained and even was part of the Peace Corps, a health educator who has been involved in many aspects of health education, myself as a physician who has been intimately involved in changing a major part of the healthcare system, and I brought us all together, a nurse practitioner who loves to help people, is generally concerned. We give people an extraordinary amount of time because we're never in a rush. We space out our schedules so that each patient feels welcomed and nurtured and supported and guided. That's what we all do. We come together as a team. In healthcare today, we call that integrative medicine. And it, by and large, doesn't exist because it's very costly to bring all these professionals to one place working together as a team. But I said it's the only way to help people through the struggles of weight and diabetes and heart disease and cancer. Even dementia can be affected by early intervention.
Now, before we continue along these lines, I just would like to throw in maybe an example that you can give. A couple things. Number one, you certainly talk about weight loss to a great degree. I don't know if that's the main focus or that's a result of a lifestyle change, but something else that I'd like you to discuss for a moment, and that is so many of us go to our primary physicians and have our annual checkups. And the physician will go down the list. Well, you've got a little of this, you got some cholesterol issues, you could be pre-diabetic. You know, you really should lose 50 pounds, Howard. Now I'm talking about myself. You really should lose some weight. I now have a conversation with you and say, I'm not quite clear on the difference because when I go to my doctor, is he or she not prescribing me these preventative measures, because I'm not sick yet, thank God, but nevertheless he's sharing with me the things that I should do. Where do you draw the line between what that primary physician's office is capable of doing compared with what MDPrevent is capable of doing?
So in fact, Howard, we don't draw lines, and that's what makes us different. For example, I always tell the story, when I was a young boy, my father drove an old car, and one day the red light went on in the dashboard. So we took it to a gas station, and my father said, "Can you help me?" And the guy said, "Sure, we'll disconnect the red light." And in fact, that's what I found has been the case about medicine in this country for so many years. Doctors don't have time to do anything but treat that symptom and disconnect the red light. It takes time to make a difference. And what we do is we investigate like good detectives. In fact, just today we discovered a thyroiditis. It's a type of thyroid disease because we kept digging. When I see a patient, a close friend of mine who you know, whose blood pressure has been increasing, the doctors keep increasing his blood pressure medication. And I keep saying to him, what are the doctors doing to try to figure out why the blood pressure is rising in the first place? I know he's under stress. Is stress a major contributor? Have they referred you to a psychologist? Could it be something you're eating? Have they referred you to a nutritionist? And the answer is, unfortunately, no, because the doctors are very narrowly focused on what they do, and that's why we have specialists and subspecialists and sub-subspecialists. We don't look at it that way. Nobody has all the answers, but we have all the time. And time makes a huge difference when it comes to people's health. We dig in deep until we know what is at the root cause of the problem.
So it's not that you're saying what the physicians out there are doing is wrong. It's just their focus is medicine and treating illnesses or things that may be going wrong in your body. And your focus is, let me show you how to prevent these things from ever occurring, or if they have occurred, we'll get it to stop through this process.
Right. We believe that food is the major cause and cure of most disease in America today. And to get into food, you have to have a detailed conversation, because most patients walk in saying, I eat well. But once we delve into the specifics of how they eat, we find out that's not the case. Cheerios is not a healthy cereal. And
as
yet,
the commercial suggests.
Correct, just as it says, a heart healthy cereal that if you consume this type of diet, it's healthy. Well, you know what? Consume that type of diet, leave out the Cheerios, and you'll be much better off.
Well, talk about wellness now. I want to put up a slide that talks about the health risk assessment, the dietary supplements, which, if any, that you should be taking, and a prevention plan.
Right. So when we talk about wellness, we talk about the state of your mind and the state of your body. Is your body essentially free of disease? You know, Howard, there's a theory that we have cancer. Every human being develops cancer all the time because cancer is random mutations of cells. But what happens? Why don't most of us develop full-blown cancer? Because our immune system destroys those fledgling cancer cells. So wellness is having a strong immune system capable of defeating virtually any illness other than possible infections that we might come across. And even infections, if you have a strong immune system, you get a certain protection from those as well.
Weight management, as you've alluded to, is really the core of a healthy lifestyle, because I guess that old adage, you are what you eat, never rang truer than today. Talk about your weight management program, a system that you've created called LEAN.
Right, so LEAN stands for Lifestyle, Education, and Nutrition. Our program is not based on drugs, on injections, on surgery, on counting points. Our program is what I call the one and done program. I personally spent $1 million investing and developing this program so that people would have to go through it once and be done with it. Because the core of the program is to understand why you do what you do, why you eat what you eat, when do you make mistakes, what contributes to your attachment to food. Is it a positive attachment or is it soulless for you? When do you make the mistakes that are contributing to problems? Is it when you come home from work and you open up the refrigerator and you grab the first thing there? Who's sabotaging your efforts to lose weight? How do you have conversations with those people and address those saboteurs? What is willpower? How do you control for it? How do you reinforce it? These are the psychological, emotional. And then we get into nutrition. What is processed food? What is good about processed food? What is bad about processed food? What types of food should you be eating? What aspects within that food should you eat? When should you eat it? We delve into 90-minute classes, 16 classes, going into every possible aspect of your relationship with life, with food, with stress, with the other people around you, because they are influences on whether or not you're going to lose weight.
You know, I must be honest, it's a bit awkward having this whole show talking about something other than life insurance, because that's what I know. But on the other hand, it was so important for me, once I had our initial conversation, to try to convey to our viewers and our clients and prospects out there the importance of a healthy lifestyle, not just for their own good, but when you relate it to my industry of life insurance, there's so many benefits. The healthier you are, the healthier that you are, the lower the cost of your life insurance is, and so on and so forth. Now, the next couple of slides are some of your marketing pieces about Get Lean and the Sweet Life. I want to ask you, relative to this focus of weight management, to make sure that people understand and can differentiate between going to a weight loss center, going on a diet, compared with, that's not what your message is. That is not what your program is. It's a complete lifestyle change. I think so many people have a difficult time. We all try different diets and we say in our minds, oh, I'm changing my lifestyle. But people really aren't. They're following a particular program, but they haven't been re-educated or retuned or refurbished in their mind. Is that an accurate statement?
It is, and part of the problem is the supplement industry. And I have been a vocal critic of this industry because it has convinced people that by taking these different types of supplements, they have a licensing effect to eat whatever they want. And in reality, supplements will never, ever be a substitute for whole foods. And that's why we get into the specifics of which foods present the best vitamins, minerals, antioxidants, synergistic nutrients, enzymes, coenzymes, trace elements, antioxidants. These are all part of whole foods that you can't get in isolated pills. And the problem here in America is that people think that prevention is diagnostic tests. Diagnostic tests are only early detection. They don't prevent. But eating the right foods, exercising and getting the right physical activity, managing your stress effectively, getting appropriate sleep, these are the types of things that prevent disease. The Centers for Disease Control have stated emphatically the evidence for the power of prevention is now indisputable. That's what we practice. That's what we preach. That's what we live at MDPrevent.
Well, our viewers are just seeing a graphic of the Sweet Life. You've created a program called the Diabetes Sweet Life Program. I assume that diabetes is probably the #1, if not close to it, ultimate killers of Americans and maybe many throughout the world. But aside from passing away from that disease, the things that occur during someone's life who has diabetes is so debilitating and treacherous. What is it that you're doing to try to reverse the symptoms of diabetes and just eliminate it from someone altogether?
So first, let's understand, what does diabetes do to people? And that goes back to my 20 years of being in nursing homes and assisted living and adult daycare. It destroys your vision, robbing you. It destroys your kidneys. It eats away at your feet because you can't get enough blood flow, and people end up with amputations. So diabetes is a devastating disease, and it is majorly affected by the foods that you eat. Unfortunately, once you're a diabetic, you become more limited. You can't enjoy fruits as much as you could earlier. But there are still things that you can do to decrease your dependence on medications, insulin, metformin, etc. And what we try to do is teach people that you can still live a full life, that the game is far from over. It's only the first quarter. It's only the first inning. Just because you have diabetes, you can still live a sweet life. And that's what we try to do. We try to improve their physical fitness, their nutritional status, again, their overall enjoyment of life. And by doing that, they can still live a full, enjoyable, healthy life.
Now, we talked about Medicare providing coverage for your program. We discussed that there's no copays, no costs, no deductibles for them. Does that mean that that is the average age, someone who is receiving Medicare, that should be into your program? Who are you really reaching out to, if not everybody?
I don't care if you're 9 years old or you're 109 years old. Everybody can benefit from what we do. I have yet to sit down with a patient who I have not had a positive impact on their life. And that's not my words, that's their words. We spend the time with them until we have had a breakthrough of some sort. I had a lady who came in several weeks ago. She's in a wheelchair. She's overweight. She said to me, I'm not interested, I'm only here because my daughter brought me here. And I spent a half hour talking to her about the pluses and minuses of improving her health, and she's now coming to our weight loss program. We can make a big difference in people's lives, but they have to be willing to change. It is a partnership. There is no pixie dust. Unlike Dr. Oz, I don't promise miracle cures and magic pills because they don't exist. If they did, I would take them myself. Howard, I don't know if you remember, I told you my story. I was 25 pounds heavier. I had reflux. I had irritable bowel syndrome. I had pain in my hip from osteoarthritis. I had cholesterol close to 300, and I was diagnosed as pre-diabetic. I was taking Prilosec and antacids. I was on a statin. And today, I am happy to say I lost the weight, I lost the reflux, I lost the irritable bowel syndrome, the osteoarthritis is gone, my cholesterol is normal, and my blood sugar is normal, all because of the same exact things that I want to do for people I've done for myself. And that's why I'm so passionate about the possibility for change. Everybody at any age can benefit from what we do. We can change lives immediately. You will feel better tomorrow by eating different food. I promise you. And in fact, on my weight loss program, I am so sure this program will change lives that I will refund money to any person that does not believe they've got a great benefit from the program.
Well, listen, it's all about education, no question about it. I'm going to give you 1.5 minutes to do a quick case study on me. What is it that I know you're not doing for me, I'm doing it for myself, but just quickly walk me through. I'm a tremendous candidate. I can prevent things from occurring with your help. Where do we start?
Well, the first thing we would do, Howard, is have you sit down with the different team members. Have you meet with the nutritionist and understand what does your diet look like. Sit down with the health psychologist and figure out if there is any events in your life. Is there any psychological baggage? If there's anything that may be contributing to why you eat the way that you do. Sit down with myself or the nurse practitioner and make sure that there's nothing in your health history, such as thyroid disease, that might be contributing to a slow metabolism. We might do some blood work to make sure that there are no known nutritional deficiencies or no anemia or no other type of problem that would interfere with your ability to make changes and see changes from your own actions. And once we've done that, we would create a plan for you. And with that plan, we would make sure that you buy into the plan. Because the fact of the matter is, giving you a plan that you don't believe in is a waste of effort and time and money. So we've got to have a plan that you say, I can make those changes. I can do those things.
And that's really where the education is going to begin.
Correct.
I'm going to cut you off for a moment. I want you to just tell everybody, how do they get in touch with MDPrevent? How do they receive more information in the last minute?
So you can go on mymdprevent.com. You can go to and call 561-807-2561. You can go to ZocDoc.com and book an appointment. You can come to our office. I can't promise you we'll have an opening at that moment, but we will be happy to see you. We have a wonderful staff. Everyone at MDPrevent believes in helping people. We select people based on their empathy and their compassion and their genuine desire to help other human beings. When you come into our center, you will know that you are in a different place. As you see, Howard, I don't wear a white jacket. I want people to feel comfortable. I have inspirational quotes and posters on my walls and beautiful furniture and teal and green colors because I want it to be a warm and inviting place. We have exercise classes and cooking classes and mindfulness meditation classes.
Well, I will tell you, this is not the last time you all are going to hear about this. You're going to see a transformation in me. Dr. Charlap, I want to thank you for being here. This is tremendous. I'm glad it's something that I could also provide to my viewers, my clients and prospects with respect to the life insurance. And please, give the doctor a call. You have his number. It's been up on the screen. Ladies and gentlemen, it's so important. Take care of yourselves, your health, to live a longer life. I'm Howard Kaye, asking you to be sure to be with us next week when we tell you more secrets of how to die rich and, more importantly, live rich.